The COVID-19 pandemic has radically changed our world, affecting millions of people. After more than a year of uncertainty and anxiety, the life-saving vaccines we have been waiting for are finally here. A lot of hard work still lies ahead, but the hope these vaccines bring is a glimmer of light for everyone. In the race to get as many people vaccinated as soon as possible, countries need to develop rollout plans. Adequate resources for implementing a plan can only be raised when we know how much it will cost. The estimation of costs needs to be done credibly, taking into consideration the various strategies being proposed to ensure that vaccines reach the target populations. The estimation of costs should be undertaken alongside the development of the plan, as countries should not plan for something that is unaffordable. When proposing strategies, a close eye needs to be kept on the available budget. Planning and costing a vaccine rollout on this scale can be a big challenge, and one which could take considerable time and resources to put together. In a way, it's a lot like building a puzzle. There are plenty of moving pieces, and trying to see the big picture while the clock is ticking is not easy. To help you effectively cost your country's rollout plan, the World Health Organization and UNICEF have developed the COVID-19 Vaccine Introduction and Deployment Costing Tool, or CVIC. The CVIC tool is an Excel-based costing platform with a large amount of country-level data preloaded. The primary purpose of the CVIC tool is to produce cost estimates rapidly by using data averages. The preloaded data is concerned with demographic, epidemiological, geographic, and logistic information, as well as health financing and human resources. While the preloaded data makes it less time-consuming for users to generate results, all data should be checked and, where possible, replaced with more reliable data specific to your country. Adding the relevant country-specific data using a team-based approach is particularly useful, as various stakeholders can participate in solving the puzzle together. This also ensures that the solution has wider buy-in. Harnessing the support and problem-solving skills of your team will ensure a much smoother and more accurate process. And remember, support on using the CVIC tool is available when you need it. The CVIC tool is specifically customized for COVID-19 vaccinations and recognizes that a bird's-eye view of multiple delivery strategies needs to be considered before and after vaccine rollout. It also takes into account the uncertainty of some parameters, for example, the time it takes to vaccinate a person. The tool allows you to factor in costs for human resources, vaccine transport, cold chain, last-mile service delivery, and more. During the design phase of the CVIC tool, relevant key stakeholders were consulted, and the needs of countries and partners were taken into account. These findings led to the development of a partner resource mapping function, making it easier for countries and partners to work together. A solid, credible, costed plan is vital for an effective vaccine rollout and partner financing. Using the CVIC tool allows us to see the bigger picture, taking us one step closer to a COVID-free world.